It's my honor to present the Gustav O. Lienhard Award. Each year, the IOM presents the Gustav O. Lienhard Award to recognize innovative, pioneering efforts toward improving personal health services in the United States. Through a generous endowment, the Robert Johnson Foundation established the award in 1986, named in honor of the first chairman of the Foundation's Board of Trustees. I'm very pleased to announce that the recipient of this year's Lienhard Award is Stephen A. Schroeder, the Distinguished Professor of Health and Healthcare in the University of California, San Francisco Department of Medicine, and the Director of the Smoking Cessation Leadership Center. Steve's contribution to improving health services in the United States are incomparable. An internist by training, he has devoted his career to advancing and protecting the health of the American people. His work has touched on every aspect of healthcare delivery: the training of healthcare professionals, the financing and organization of healthcare, improving the quality of care, and broadening access to preventive services. His contributions have helped define the fields of health services research, general medicine, and preventive care. At UCSF, he founded the Division of General Internal Medicine and conducted research and training programs of national significance. And at George Washington University, he was the founding medical director of a university-sponsored HMO. As president of the Robert Johnson Foundation from 1990 to 2002, Steve established programs to expand health insurance for children, encourage physical activity, and enhance end-of-life care. He oversaw the largest study ever conducted on the quality of care for those who are seriously ill and dying, and he instituted a national initiative to improve health for seriously ill hospital patients. The initiative minimized legal barriers to prescribing pain palliative care at the end of life, energized patient groups, expanded hospice and hospital-based palliative care, and engaged hospital chaplains. As a result, more than 500 hospitals received training in palliative care, and many launched their own programs. But perhaps Steve's most singularly important work has been in the field of tobacco control, specifically smoking cessation. His most enduring contributions at RWJF focused on leveraging research, policy, advocacy, and education to reduce tobacco use. This was a major new direction for the Foundation, and his leadership was courageous and groundbreaking. He helped trigger policy changes that created higher tobacco taxes, smoke-free indoor air laws, and better access to addiction treatment. The impact of anti-smoking campaigns by the Foundation and its partners was profound. Smoking rates declined markedly. As a result, by 2011, 5.3 million fewer people were smoking, and more than 60,000 smoking-related deaths have been avoided. After leaving the Foundation and returning to UCSF, Steve founded the Smoking Cessation Leadership Center. While the majority of current smokers, about 70%, say they would like to smoke, only a small fraction, about 5%, are able to stop smoking without help. Under Steve's direction, the center has dramatically increased the number and types of clinicians who can successfully support smokers' attempt to quit. He created new ways to market toll-free telephone quit lines and engage the mental health community in treating tobacco cessation. For the extraordinary contributions he has made and will continue to make to the health of the American public, I'm delighted to present this year's Gustav O. Lienhard Award to Stephen A. Schroeder.
Wow. Well, thank you, Dr. Kington. All of you surely recognize that those achievements just mentioned reflect a collective effort that involve many dedicated colleagues at RWJF, at UCSF, and all over our country. To give me this honor, you're honoring all those who helped in this effort, so thank them. And it's daunting to be included in the distinguished list of previous Lienhard winners, one of whom is sitting right there in the front row. On this very special occasion, I want to recognize my family, starting with my parents, who unfortunately can't be here today, who told me almost daily that we all had an obligation to help the less fortunate, that I should try to make a difference, and that I had the capacity to do so. My early educational experiences were somewhat checkered, so I didn't fully believe that last exhortation. Next comes my wife, Sally, whose integrity, compassion, and fairness still anchors our family. Thank you for being you. Finally, we are blessed with two wonderful sons, David and Alan, who are here also, who chose medicine as a career for the right reasons and are not only fine physicians, but such good husbands and fathers. We're so proud of you both. Lastly, it's easy to be discouraged these days, as our nation seems to have lost its way and all too frequently looks like it's mean-spirited. Yet, as I look back over the last 50 years, and David and I were at the MLK monument yesterday, there's been such impressive progress in social justice and public health, including smoking, deaths from car crashes, and I think we have the potential to make progress in gun violence too, because I was struck, as I'm sure many of you were, with the similarities to smoking. Obviously, there's still much to do, and progress can seem excruciatingly slow, but we're running a marathon. It's not a sprint. We shouldn't be discouraged, and we must hold out hope to the next generations. The people in this room today can be a big part of making that happen. Thank you so much.
Steve, we can all do our part if we can only follow your example. Thank you for all you have done and continue to do on behalf of health in so many ways for the people here in the U.S. and really around the world. We're proud to have the opportunity to recognize you in this way. We've had a very full, a very exciting morning, and there's more to come this afternoon. But between now and then, we have an amazing array of options, not just nourishment for your bodies, but also for your minds. There are several choices of luncheons that I hope you'll think about attending, including the Committee on Human Rights luncheon. There will be an impact luncheon where people I know have already signed up, and I look forward to seeing others there, as well as the prize luncheons, including the Sarnat Prize Luncheon, where we'll have the opportunity formally to give the award to our winner this year. Let me thank again the organizers. Thank you all for being with us. We will reconvene promptly at 1:45 p.m. for the afternoon program.